Our next speaker is Dr. Damien Barrett, who's undertaken a PhD on the consequence of Schmallenberg infection in Ireland. But more importantly, along with John Mee and Michael Doherty, they were the mainstays of the scientific committee of this very successful Buiatrics Congress. So as well as looking forward to his presentation, we're very grateful for them for organising such a wonderful conference. So with that high praise, Damien,
thanks very much.
Your presentation.
Thank you very much. I'm just going to talk to you now about a study we carried out on the impact of infection with Schmallenberg virus on weaning rates in Irish sheep flocks. Now, Schmallenberg virus, as you're all aware, emerged in Europe in 2011. The first confirmed case didn't emerge in Ireland until October 2012, and it was subsequently confirmed in 49 cattle herds and 39 sheep flocks. These were most of the studies carried out on serology and in terms of pathological findings. They gave a good geographic representation of what was going on, but it was difficult to quantify the impact on productivity at a flock level, and this was caused quite an amount of anxiety among sheep farmers coming into the spring of 2013. So the objective of this study was to assess the impact of Schmallenberg on weaning rates, to answer that question, but also in a wider context to see could we use a measure such as weaning rate as an indicator to be used in emerging disease surveillance systems. So this was carried out using a questionnaire and was distributed among 70 Teagasc advisory staff. This is the agricultural extension service here in Ireland, and they had a scheme at the time called the STAP, the Sheep Technology Adoption or Program. We got 267 valid responses. We discarded 70 because they were incomplete data, and the outcome variable was the 2013 weaning rate. We used Poisson and negative binomial regression analysis. And if we just look at this here, most of the confirmed cases were in the southeast of the country. And if we look at here the flocks in red, these were flocks where Schmallenberg virus infection was confirmed by PCR. The flocks in yellow were flocks where infection was suspected by the farmer with no laboratory confirmation. The flocks in blue were flocks where there was no reports of Schmallenberg, but they were in counties in which Schmallenberg was confirmed. And the flocks in green were flocks where Schmallenberg was not suspected and there was no cases confirmed in those counties. And this is the model that we developed from this. And there were really 3 or 4 main findings. In terms of Schmallenberg itself, we found that there was a 10% reduction in weaning rates in flocks where Schmallenberg was confirmed. That was where it was confirmed only. If the farmer is suspected, it wasn't statistically significant if a farmer suspected Schmallenberg was present. It was only in cases where Schmallenberg was confirmed by PCR. Unsurprisingly, we found that the breed type was an important determinant of weaning rates, where we found lowland flocks had a significantly better weaning rates than hill flocks. And again, unsurprisingly, the 2013 barren rate was a predictor, the Yo barren rate and the 2013 weaning rates, which probably was a reflection of management and breed type. So as we said, there was a 10% reduction in weaning rates where Schmallenberg was confirmed, and we believe that this is a justifiable concern for sheep farmers. But we would emphasise that it was only observed in flocks with a confirmed diagnosis. As I said, the other factors found to be influencing breeding rate or weaning rate where lowland breeds were better, the 2013 barren rate and the 2012 weaning rate itself. But the other thing we did see was that there is a value of production data that the value in production data informing management decisions is well recognised, but access to these databases could also be important from a population level, and this information could be useful to help risk managers to quantify the costs. And although we could tell farmers at the end of the epidemic that that it would have had that it did have a 10% reduction in weaning rates, that was actually reassuring to the farmer population. Now, the major limitation of these data is that it's retrospective in nature, and if the optimum system should consist of more real-time measures, including lamb mortality rates, abortion rates, ewe barn rates, weaning rates, and ewe cull rates. So I'd just like to acknowledge the farmers who participated in this study, the Teagasc advisory staff that distributed the questionnaire for us. We also got some help from Department of Agriculture Veterinary Inspectorate staff to follow up in some cases, and I'd like to thank Mary Claire McCarthy who entered the data for us. So any questions, please?
Thank you very much, Damien. Do we have any questions, please? Yes, there's a gentleman on the left.
Damien, very interesting. Can you just tell us, were there any other evidence of, either through analysis of milk data or of the cattle and beef industries, and how the Schmallenberg affected or the antibody sequencing through the country over time? So what happened over those couple of years? Did the whole herd or the whole country become immune, or what happened, Damien?
Well, I have another talk later that'll go into more detail on that, but what happened basically from a seroconversion point of view, seroconversion was effectively confined to the south and the southeast of the country, and as we moved up from the southeast, say Wexford and the very tip of the southeast to the northwest, that levels of seroconversion reduced. But South Leinster and Munster, South Leinster and predominantly southeast Munster were the areas most affected, and for some reason, and we think it's probably related to the time that Schmallenberg was introduced into Ireland, that we only got a partial seroconversion within the country. Now, within cattle herds, there was almost complete seroconversion. It was fairly incomplete in sheep flocks, though.
Any further questions? Can I ask you, Damien, why do we see no problems in subsequent years, or have you experienced, why just a one-off hit and then the disease appears to have disappeared?
I can only really speak for Ireland here, but what we discovered was that Schmallenberg was introduced to Ireland. Our best estimate is in the first 2 weeks of August 2012. And modelling work by Paul Russell, I think, in Edinburgh, or certainly in Scotland, I'm not sure it's in Edinburgh. He has shown that the later, if that were to happen earlier in the season and in a warmer year, now 2012 was a very wet year, but it was a cold year as well.
Okay.
That if the temperature was warmer and if the incursion had happened earlier in the year, then we would have got higher levels of seroconversion. It just happened that the virus came at a time of year when it was moving up the country, that it was actually stopped in its tracks by the cold as October and November came on.
The beauty of being in Scotland as well. There's a lady on the right-hand side, please.
Hello, yes. We had similar in Germany, that when they need to get infected the first time in the specific age of pregnancy, and we did studies about how long the antibodies stay in the animal, and we got nearly to 3 years of staying with antibodies, but we didn't know if they are protective or not, because since we had 2012 and 13 the most problems, in 14 we didn't nearly have any problems anymore. We still have antibodies, but we don't know if they're still protective. But I have a poster for it, so if somebody's interested.
Great. Thank you very much for your comments. One final question, if there is one. If not, then we'll move on to our final speaker,